Hello and welcome back to the A to Z of the NHS. We've made it to the letter E, which, to be honest, is a bit further than I expected this series was going to get, so things are moving along nicely. And with feedback from yourselves, we've adjusted some of the things that we're doing. We're still going to do the news roundup, but we're now going to split our conversation, shall we say, into three. We're going to try and answer a fact or fiction issue. We're going to go over a simple question, and also the final bit of each condition we talk about, we're going to go through something your doctor won't tell you. Let's talk about erectile dysfunction. So, following our new three-step organisational structure, what's our fact versus fiction for erectile dysfunction?
Is masturbation bad for your health?
Are you trying to backdoor will masturbation make you blind?
Yes, viewers, I am.
Okay. So, and our final bit on erectile dysfunction will be what the doctor doesn't tell you.
I'm going to get into a slightly naughty, dirty area, and that is pornography. And I think it's about time we had a grown-up discussion as doctors.
Look, have you been looking under my bed again?
I never ever look under your bed at all, James. He keeps it in the cupboard. It is a serious issue, and I think that we should talk about it
Absolutely.
in a semi-serious way.
And I think a good part of that is going to be about language, and we're going to discuss with that how, yes, pornography may be a naughty subject, but perhaps not phrasing it as a dirty subject, and we'll talk about how that language is so important for these things. So, let's start off with that fact versus fiction, Andy. So is ED a disease?
I don't think it's a disease, actually. I think it's probably part of the normal aging process.
A bit like grey hair.
A bit like grey hair, or lack of hair, viewers. In other words, it's normal for men as they get older to have erectile dysfunction. And I think we probably worry too much about it. I'm not going to tell you today whether I've ever had it, but I can tell you that 50% of the population have it, and interestingly, 30% of people age 20 or more have it. There's a particularly good study on medical students, actually, and about 150 of them were sent questionnaires, and 30% of these young people said they had erectile dysfunction.
Well, I'm not surprised. I mean, as you very well know, medical students are practically asexual. They don't have sex at all.
Maybe. There is the odd rugby tour and hockey tour where the odd shandy is taken, I'm told.
I wouldn't know. I was not strong enough to go on the rugby team, and I was actively uninvited from the hockey team. So,
well, one day I'll tell you about the shenanigans of a rugby tour. Anyway, let's go back to this fact or fiction about whether it's a disease or not. In some ways, it does seem to be a disease. It seems to be a silent marker for ischemic heart disease and cerebral vascular disease, in other words, heart attacks and strokes, implying that the pathophysiology, that's a doctor's long word for how it causes the problem, is related in some ways to the blood vessels that go to the penis. Now, as you know, the penis is a very vascular organ. It's like a big sponge full of blood, and therefore, if the blood supply to the penis is affected by whatever disease, it's going to affect the ability, or one's ability, to have an erection. In that way, you could argue that it's a disease, but as I've said, it's so common that we have to postulate that it may not be a disease. Whenever you have something that is really, really common, like depression is a good example, you have to wonder whether there's some advantage to it. Otherwise, evolution would have got rid of it. The only slight complexity of that argument, of course, is because through most of the history of the human race, and we've been around in some form for 100,000 years or so, we haven't lived long enough to get erectile dysfunction. So it could be that erectile dysfunction is actually a feature of aging from an era that we're not meant to get to.
People, have difficulty reproducing as they get older. Ladies, as they get towards the menopause, find it more difficult to conceive. But that's because we're actually designed, or we function best trying to look after children when we are young, when we can survive on 4 hours sleep a night.
As you know, I had children quite late in life, in my mid-40s, and it was certainly a challenge, I can tell you. In terms of what's normal, the way to work it out, as I said, is that up to the end of your 20s, up to 30% of people have had it or have it, and then you add about another 10% a decade, so that the overall figure is about 50%. But the higher rates are in older people. When patients have it and they go to their doctor, what frustrates them normally is the doctor says this is a complicated problem comprising physical and psychological elements. Do you ever say that to a patient, James?
Not in those exact words. Normally it's like, okay, there's a lot of stuff going on here. Let's see what we can tease out and see what's going on with yourself.
GPs will, like James, will be dealing with such patients initially. People like me are in the background. And James got to deal with the complexity of something like erectile dysfunction, where there is often a physical cause like atheroma, that's furring up of the blood vessels that causes heart attacks and strokes, and diabetes, or both. Sometimes the drugs patients are on can cause erectile dysfunction. Then all of that gets confused in a mishmash of stuff related to your family life, your personal life, your sex life, your tiredness, your work responsibilities, etc. Because there aren't many people in midlife who get to Friday evening having slogged their guts out all week, working long days, who get home late, who have sex as the first thing on their agenda on a Friday night. Normally they just want a gin and tonic and an ice bath. The problem, if it is a disease, patients have to be investigated. There are simple blood tests one would do initially. It's important to examine the patient, feel the pulses in the legs in particular, because often if there's a lack of blood supply to the legs, there may be a lack of blood supply to the penis and the scrotum, etc., etc. It is also important to examine the gonads, that's the genital area, to see if the patient is hypogonad. That means they haven't developed characteristics such as pubic hair, for example.
Well, that's often a big thing that patients come in when they have that conversation, come to the doctor and say, Chief, it's not working, can you help? One of the things that we always ask is, what are you hoping we'll do for you today? And almost 9 times out of 10, the chaps are asking for a blood test to check their testosterone level. And there's an easy way you can see if someone's got, acceptable levels of testosterone. Do they shave every day? And that's often quite a relieving feature for patients, and saves the NHS money, just saying, yes, you have sufficient. I mean, conversely, as younger people, when they end up with lack of hair, that also suggests that they've got higher levels of testosterone, because the testosterone converts to another chemical, DHT, which actually then kills off your hair follicle. So when people sort of make comments about chaps that don't have much hair on top, actually they're probably more flush with testosterone than not.
So patients been through the normal assessment process, the history, the examination, investigation, including testosterone, but then you're often left with a problem that is partly physical, as I say, and partly psychological. The physical side, you can do some things like ask them to lose weight, stop smoking, reduce their alcohol consumption. You can ask them to not use that particular tablet for their blood pressure rather than, or use that tablet. But that having been done, often then as a GP you have to decide, am I going to take this further in terms of psychosexual counselling, because it often is a psychological component to erectile dysfunction.
Well, you said about 30% of chaps coming in their 20s with erectile dysfunction. It was actually, I used to work in the GUM clinic, which is not the STI clinic, it's not the sexually transmitted infection clinic, it's the genitourinary urinary medicine clinic. Basically, we deal with everything down there. And actually a large number of chaps would come in because they couldn't get it up. And because of no infections, and largely it was performance anxieties and issues with depression and that psychological aspect to it. And that performance anxiety is exceptionally difficult for people because It's like a snowball going down a hill. You know, it starts off, oh, it didn't work this once. What happens if it doesn't work next time? Oh, it hasn't worked this time, and it keeps on going and going and going. And from that side of things, it can be very difficult because you're having to reassure the person that it's all working. And one of the things that we can actually talk about as a positive is masturbation, as a way of showing them themselves that actually everything is working well, and this is something that they can overcome. You said that ED, it is a disease. I'm going to push back. Everything that you've said, erectile dysfunction with depression, erectile dysfunction with obesity, erectile dysfunction with alcohol abuse, erectile dysfunction in heart disease, I would argue that erectile dysfunction is a symptom, in the same way as your cough is a symptom of your chest infection or your heart failure or your ACE inhibitor use. Because it's something that we look to the cause to fix, but it's a symptom that is so bad that people consider it a disease in its own right.
I must admit, I hadn't thought about it that way, James. I think that's quite a good way of thinking about it, because clearly there are cases where there is a single identifiable cause. You've started a particular tablet, they develop ED, you take the tablet away and the ED goes away. But most cases are not like that. They are more complex, as you say.
And here's the segue. Because it may be a symptom, if you've got erectile dysfunction, if the chap's not coming up when you need him to, talk to us. We want to know about this. We may be able to help you quite simply with a bit of advice, but actually there may be something more significant going on that we actively need to get involved and help you. So, really, if you're suffering from erectile dysfunction, speak to us, please.
James, having assessed the patient, has to decide whether to refer the patient up to the hospital or not. Traditionally, ED is looked after by kidney surgeons, doctors we call urologists. Often there is a special ED clinic and even an ED nurse, and these clinics are in existence and are there in your local hospital. What will they do? Well, they'll largely repeat the things that the GP has done. They may do some other tests that the GP hasn't done, but they may end up with a focus on the treatment rather than the cause. They have a wide armory of treatments, including some rather old-fashioned ones like penile injections.
So probably kill the mood.
Yes, definitely. They're very effective, though, I'm told. There are penile implants. That's a minor operation, probably not so minor if it's on you. They're going out of fashion. Then we have drugs like Viagra. The doctor's name for it is sildenafil, and there are alternatives to that particular type.
Now, I find that actually very useful for psychological erectile dysfunction, because often the patient is it me? And actually we can say quite simply, right, tell you what, go home, take the tablet, have a crack, see if it works. If it does, then at least you know at the moment all of the plumbing there is working well. Come back and we'll continue the discussion and see where we're doing. Obviously, we're making sure the patient doesn't have any contraindications to a trial of that, but that can be really useful, overcoming that psychological hurdle of I'm broken and I won't work anymore.
Fortunately for many of our patients with kidney failure, with diabetes, with high blood pressure, and a lot of times it can be more physical than psychological. But even our patients have a psychological edge to it. I had a patient long ago who was on dialysis, he had diabetes, he had several reasons for being impotent, and he talked to me about it, and I recommended something called an Erecaid. Have you heard of an Erecaid?
No, I haven't actually. Tell us a bit more, Andy.
Right, so what is an Erecaid? An Erecaid is a plastic tube that you put over the penis. It takes air out of the Erecaid, forming a vacuum that leads to an erection. Then an elastic band on the base of the Erecaid is pulled down, the Erecaid comes off, and the patient is left with a pretty good erection. And anyway, when I recommended this treatment, unfortunately not available on the NHS, to my patient, he was initially unsure. He didn't think it'd be very romantic, but a couple of months later and said, "Dr. Steen, my life is so much better now." He said, I'm getting great erections. My wife likes it. I like it. It's made a big difference to my life. And he said, do you know what? I do it without the Erecaid. And I said, what do you do? And he said, well, I leave it in my top drawer. I make sure that myself and my wife are in the mood. And then what I find is that if I walk towards the drawer where the Erecaid is, the action of walking to the drawer gives me an erection. It makes me excited. It's sort of Pavlov's dog response. And then I return from the drawer with my erection, and then we make love.
And I imagine that has had a significant impact on multiple levels of his health, not just in terms of the relationship between he and his wife. So the question that you alluded to is, can masturbation make you blind? But I suppose what we're asking him for is, are there any health benefits to masturbation? And hopefully you've seen that we've certainly talked around the fact that there may be, and hopefully no one at home is surprised to hear, yes, masturbation is good for you. Now, I'm not necessarily promoting it. I am actually. I'm going to scrub that. Now, I'm not actually, okay, I'm going to change that. Because of what we're talking about, yes, I am promoting masturbation. It's good for you, okay? It's going to lower your blood pressure. It's going to improve your sense of self-worth, assuming that you're doing it in a positive fashion. It's going to improve your cardiovascular fitness. It will stimulate blood to other areas of your body. But here's the crucial one that not a lot of people know. There was a study, well, plenty of people who've read the study will know. There was a study, I think it was in the journal Urology, I read a few years ago now, that masturbation at least twice a week is actually protective against prostate cancer, because it's clearing out all the free radicals and things that end up sitting around in the seminal vesicles. So essentially you're flushing the system every time you do. It's the same reason why we think that sleep is protective against dementia, because at night your CSF ventricles open and your brain literally can flush out the toxins that you developed with all that heavy thinking across the day. There are things that we do as biological organisms. I mean, we've all seen David Attenborough TV shows where the gibbons having a quick shufty in the corner. If gibbons are doing it, and gibbons are sleeping as well, this shouldn't be considered a deviant act. This is actually part of mammalian life, and it's good for a reason.
There is no evidence that masturbation is bad for you, that makes you blind, that it's wrong. It may even be good for you in the ways that you have described. And after all, we are primates. Anybody who's seen a documentary of a bonobo would realise that most bonobos spend most of their day having sex or masturbating with anything they can find.
Have you actually seen a bonobo masturbating? I have. Okay, and
not yet.
I will see if I can find the video for it. It's practically elastic the way they tug. They really are not gentle to themselves. I think they'd end up seeing your old-time GP. It's quite shocking.
The final planned in our new system bit of this session, which is about what doctors don't tell you. Is that right, James?
Yes, you gave us a nice opening there, which I'm interested to see where you're going to go with this. That, what was the numbers? That 80% of men and 50% of women access pornography.
Yes, they do. Well, according to a really large BBC survey in 2019 of over 1,000 younger people, it was found that 80% of the men and 50% of the women were using pornography. But interestingly, the women who were questioned in this survey also stated, well, 50% of them stated that pornography dehumanized women.
Okay, now that, I think, again, we've discussed this many times, that words are important, words have value. I think that's very interesting the ways dehumanizes, not only if we're talking about in the nature of pornography, but I think maybe that relates to the classical impression of pornography. Now, I'm not going to dig into about pornography itself, but medical Twitter. Now, don't get me wrong, Twitter is largely the cesspool of humanity. If you want to find dregs of humanity, go to Twitter. However, there are islands of hope out there, and Med Twitter has a lot of it. Now, the reason why I bring up that is, as a rule of thumb, and looking at this pair of reprobates, I'm not sure we do, but medics broadly are considered to be trustworthy individuals, or individuals of some common sense and values. I'm aware of at least 2 anonymous Twitter accounts by, I think one's a medic and the other is a medical student, who are very open about their discussions and forays both into their own sexual health and also pornography as well. And somebody retweeted one of their things and I sort of had a look at it, thought, and didn't go anywhere near it. And then actually I thought, hold on, that was a very Victorian response. I've gone, oh dear, how could somebody like that, going into the medical profession, get involved in pornography? How dare they? And I thought, hold on, check yourself, Chief. And I actually read a lot of the things that they were talking about. And they have a very open way. Now, I may not agree with some, many, a lot of the things they say, but I still follow that account because it's another viewpoint. And it's certainly not a toxic viewpoint. And they're very clear in a lot of the things that they talk about being open with people. And I think that we'll put the links up to those 2 Twitter accounts because they're certainly family friendly. They're just the things they talk about. And I think that we can learn a lot about how they are open and how they view their own sexuality as a positive thing.
Moving back to the Victorians, I think we ought to think about not just where these views came from and why.
The Victorians,
but why are they perpetuated today? If one looks further back in history to the ancient Greeks in the 5th century in Athens, it was fairly normal for an Athenian male to have a wife, a mistress, a high-class prostitute, a low-class prostitute, a slave girl, and a young man that he would have sex with regularly. Like bonobos, really. I don't know how they had time, but anyway, they did. I'm not sure the women got such a good deal. But if you think about it, in the time of ancient Greece, which most people in Western civilization would call a peak of Western thinking, a peak of Western civilization, pornography was open. There were statues, there were pornographic images on vases. Masturbation happened, people weren't embarrassed about it. I'm sure if somebody had erectile dysfunction, they would talk about it in a way we don't in the modern age. So I'm not suggesting we follow everything that the ancient Greeks promoted, because they did occasionally invade certain islands and kill everybody for the sake of it. But some of the things they did, I think, were useful and we can learn from, and maybe we should start parking the Victorians. What do you think, James?
I think my Google search history is going to be terrible after this. So I'm going to have to go home now, and to get some edits for this, I'm going to have to Google for ancient Greek pottery pornography. It's a very niche fetish, I think. Shall we leave it at that?
I think we'll leave it at that.
Okay, thank you, Andy.